think patients with the thyroid cancers who come into the cubicles on ward 35 do feel quite nervous when they first come in. They have quite high levels of radiation, so from a safety point of view, to protect the nurses and relatives of the patients, there's a line as to where they can cross, so it's about time and distance, and that protects both staff and patients and relatives.
We're on our own, the visiting is very limited, and you start to think about things. It's when really the impact of the cancer diagnosis will hit home.
It's not their own home environment. They're having a cancer treatment and they're on their own. Staring at clinical four walls is not a nice thing when you're coming in for a treatment that you have time to think about things.
These patients are already vulnerable, so it adds another anxiety, and then to be put into this room where it's like a solitary confinement, it's a scary experience.
We did the biggest ever patient survey in the UK, and part of that was asking about the experience of having radioactive iodine treatment. Lots completed the survey and told us exactly about your experience, which is what we wanted to know, and the environment that we as patients have to go into to have this treatment. Most of the rooms have been in use for many, many years. The hospitals are old buildings and they're quite depressing. Even in newer builds, the rooms are very clinical. So let's help lift the mood of the patient. We know that psychological benefits help patients to get well sooner. And part of that is being in an environment that is uplifting. And with doing this wall art, this wall glamour, to take the patient out of themselves while they're in the room can only help with them getting better. So we decided to make it look better and have a much more welcoming environment for the patients.
If you come into a bright room with nice colours and a warm environment, that gives off a friendly persona as well, so that patients feel more comfortable.
A previously isolating and quite forgotten about disease is suddenly kind of given the acknowledgement that it needs. Just because it's a treatment that isn't hugely invasive, it's still a treatment that warrants a lot of issues.
We do have the butterfly theme for the Butterfly Trust, specifically for thyroid cancer patients, and a lot of patients have actually said that it's a really nice room, it's nice and bright, and it's got a warm environment, which is what we're aiming for.
When patients come into the room feeling anxious, feeling frightened, feeling nervous, instead of coming into a plain white-walled room, they come into one of our rooms and they look and they say, wow, that looks really nice. That's their first impression, and that's what we're trying to do. We're really pleased with the feedback we've had, and what we've decided to do is roll this programme out across the UK, and the uptake has been phenomenal. A lot of the hospitals, their concern is these rooms are in use every day, 7 days a week. We can't possibly delay a patient's treatment to have this done. But the people who do this do hospitals all over the country and are so experienced that they come in and within one working day, the room, the kitchen and the bathroom is done with virtually no disruption whatsoever.